In the last video, we discussed the minimum amount of protein you should consume to build muscle, or at least maintain your lean body mass while losing weight, and I have provided a quick summary of the recommendations on my right. However, I did mention that you may get even better results regarding lean body mass retention and satiety by going higher than this. This begs the question, are there any health risks associated with higher amounts of protein intake? That is what we are going to explore in this video. First, a quick disclaimer. In this video, I am only referencing individuals who do not have a medical condition at baseline that would make higher amounts of dietary protein intake potentially undesirable. The primary medical condition worth mentioning here is chronic kidney disease, especially since many people with obesity may have this to some degree without even realizing it. Please check with your healthcare provider to see if this applies to you. There are some acute conditions such as constipation, bad breath, increased urinary frequency, and potentially kidney stone development that are associated with higher amounts of protein intake. Many of these can be addressed by altering your diet overall as opposed to solely focusing on decreasing protein consumption. For example, consuming more fiber and fluids may help treat constipation, consuming enough carbohydrates to prevent yourself from entering a state of ketosis, while also practicing good oral hygiene may help with bad breath. Spacing your protein intake out can help with increased urinary frequency, and while the link between protein intake and kidney stone development is not completely established, in scenarios where this does exist, consuming more fruits and vegetables should help alleviate the risk. While these are undesirable side effects, you can address them, and you will know right away if they are affecting you. Now let's focus on some of the conditions you may not be aware of until it's too late. Considering long-term protein consumption, let's first do a bit of math. As you can see in this appendix to the 2020 to 2025 Dietary Guidelines for Americans, the acceptable macronutrient distribution range for protein as a percentage of overall calories is 10 to 35% for adults. They also generally recommend somewhere in the 1,600 to 2,400 calorie per day range for adults. You can see the math on the screen, but this comes to a maximum safe limit of 140 to 210 grams of protein per day, which is higher than what I previously recommended. This implies a higher amount of dietary protein is safe to consume, but some specific concerns have been brought up in the literature, so let's go through them. We'll start with the skeleton, where it has been hypothesized that higher protein intake may cause excessive calcium excretion and thus worsening bone mineral density. A 2021 review of the impact of nutrition on bone health discussed several systematic reviews, meta-analyses, and other lines of evidence, all indicating that higher protein intake has no negative impact on bone mineral density when sufficient calcium is consumed. A similar lack of concern was found in a separate review regarding exercising individuals. One small study in particular included women who increased their protein intake to 2.8 grams per kilogram of body weight per day for 6 months with no detrimental effects seen. Thus, it seems you can consume high amounts of protein without harming your bone health if you are exercising regularly and consuming enough calcium. If curious, the Dietary Guidelines suggest that adults aim for at least 1,000 milligrams of calcium daily, going up to at least 1,200 milligrams daily for adult males aged 71 years and older. Regarding mortality from various causes, two separate 2020 systematic reviews and meta-analyses of prospective cohort studies found that higher protein intake did not increase the risk of early mortality, while higher plant protein intake was actually protective. However, a more recent systematic review, only considering isocaloric substitution analyses, where you replace certain nutrients with other nutrients, did find increased risk with higher animal protein intake. The source of this discrepancy is not clear, and in this latter review, the increased risk was generally less than 10% when adjusting for known confounding variables. Thus, in the context of an overall healthy lifestyle and no medical contraindications, the evidence overall generally suggests higher protein intake will at most minimally increase your risk of death, and the associated risk seems to exclusively come from animal sources of protein. There is some controversy regarding high protein diets and the risk of developing diabetes. A perspective published in 2020 highlighted that protein intake may stimulate the release of insulin and glucagon while potentially impairing the function of insulin. Importantly, chronically elevated insulin levels may lead to insulin resistance and subsequent diabetes. Thus, there is a theoretical cause for concern. As one example, a recent meta-analysis of prospective studies found that higher protein intake slightly increases the risk of developing diabetes, where a 5% increase in energy intake from protein increases the risk by 8%. If you consume 2,000 calories daily, 5% of this is 100 calories, or roughly 25 grams of protein. The increased risk was driven by non-dairy animal protein as plant protein intake, as well as up to 2 servings of milk and 1 serving of yogurt daily were found to be protective. However, a recent review found that higher protein intake combined with caloric restriction generally results in improvements in glucose levels and insulin resistance, implying any perceived concerns are somewhat unfounded in the context of overall weight loss. Other reviews show these positive findings of higher protein intake, or at least a lack of harm, extend to people with elevated BMIs who do not have diabetes, to people with type 2 diabetes, and to people with obesity who are in a caloric deficit. Overall, it seems that in the context of a generally healthy diet and weight loss, you can likely go quite high in your protein intake without fear of increasing your risk of developing diabetes. If you are not actively losing weight, then there may be some theoretical concern of higher protein intake, but if you otherwise have a healthy body composition and are exercising regularly, the risk of developing diabetes will likely be quite low. The last major health consideration we will discuss relates to the kidneys. There has been a lot of debate over the years about whether a high-protein diet is dangerous for healthy kidneys. Regarding what the literature suggests, a 2017 review specifically evaluated the long-term impact of a high-protein diet on kidney function. The authors surveyed much of the literature, finding lots of conflicting evidence, and were unable to conclude about the safety or risk of a high-protein diet long-term. They thus recommend in general keeping your protein intake at less than 1.5 grams per kilogram of ideal body weight per day, and to consider testing for chronic kidney disease prior to beginning a high-protein diet. I discussed ideal body weight previously, so you can look at that video if curious. It won't change any of the recommendations I make in this video, so no pressure. More recent reviews also have conflicting findings. A 2018 review found no evidence of harm in observational studies or intervention studies, but the observational studies rarely included protein intake above 1.5 grams per kilogram of body weight per day, and the intervention studies were generally less than 6 months in duration. A separate 2018 review, only including randomized controlled trials, found no evidence of harm, with the average intervention going up to 1.8 grams of protein per kilogram of body weight per day. A more recent review similarly found little evidence of harm in intervention studies lasting at least 6 months duration, but results are more mixed with observational studies published through 2020, as several find worsening kidney function with higher protein intake long-term. A 2021 viewpoint echoed these findings, with the authors specifically noting a higher incidence of chronic kidney disease is more often found when protein intake exceeds 1.7 grams per kilogram of body weight per day. Lastly, a separate review notes that athletes who use certain performance-enhancing substances or other protocols such as dehydration to cut weight may further increase their risk of kidney harm. Thus, it seems fairly safe to increase your protein intake up to and beyond 1.8 grams per kilogram of body weight per day in the short term, but long term it's unclear how risky it will be to go much above 1.3 to 1.5 grams per kilogram of body weight per day. It still may be safe to do this, it just simply is not clear at this point. Overall, it seems there are relatively few risks of higher protein diets assuming you have healthy kidneys at baseline. If you're not sure, you will need to check with your healthcare provider to see if your own kidneys are healthy. There may be small increased risks of higher protein intake regarding diabetes and mortality, but not all data indicates this, and the risk seems to come from animal protein. How much of this is due to the specific amino acid composition of the animal protein versus the other components of animal food groups, such as red and processed meat, is unclear. Regarding kidney health, high protein intake in the short term seems okay, while in the long term this may lead to a faster decline in kidney function. Thus, my overall recommendation is to go high in your protein intake while actively dieting to lose weight, as this will help with lean body mass retention and satiety. You can aim for at least the protein minimums I recommended in the last video and go considerably higher than this if desired. Once you have finished your weight loss journey and are just working to maintain your current weight or to even build muscle slowly, back off on the animal protein to some degree if your protein intake is considerably higher than the minimums I recommend. This way you should be able to obtain a healthy body composition as easily and effectively as possible without having to sacrifice your long-term health. Anyways, I hope you all found this video informative, and I will see you in the next one. Goodbye.